people, we are back. We are in our last live stream hour, and then we will have a recap later on today. And we are now joined by my good friend from down under. So it's really like an across the pond. I mean, at least for me, I got guys on either side of the oceans on this live stream right now. Paul, thank you for joining us. You want to give it a brief introduction? We're going to keep it kind of short and sweet.
Oh, you're welcome. Thanks for inviting me, actually. My name's Paul Blamire. I've been an advocate now since 2014. I do have ties to the vaping industry, but now on a completely different level, more on an advisory standpoint, more towards data sets and towards safer concentrate manufacturing and where we should go from here in the future.
Fantastic. Yes, and you're based out of Sydney, Australia, and we got Martin who's out in South London. So for people who aren't paying attention, that's what I mean by different sides of the ocean. So Martin, you want to give any updates on what's going on right now with COP9 meetings?
Yeah, there's still some discussions going on about a draft decision, and they're currently debating basically who's going to pull up the reports for COP10. We were hoping there was going to be some sort of new working group to assess the evidence properly, but it's looking like they might be handing the authority over to the FCT Secretariat to select which evidence they want to present to parties for COP10, not just for tobacco products, but for novel emerging products as well. So, and they're hardly on our side, are they? Let's face it. So it doesn't look great. But then, you know, that's basically how we got to where we are now. With Tom Reg and the reports that they came out with. There were some positive bits in it, but it was the same old cherry-picked scientists being added in. So we expect that might happen. They haven't made a decision yet, so we'll see what happens. Disappointing, the UK didn't stand up against it. But then we, you know, this is diplomacy for you, isn't it?
Well,
So
it's
Paul,
showing where the cards are falling.
Yeah, well, okay, so Paul, can you kind of like talk to what's going on in Australia? And we actually can play what Greg Hunt's COP9 live stream or his video. And so I mentioned he sounds like an American politician with an Aussie accent. He's got like a drawl to him, like American politicians have.
He's an absolute shocker. And for anyone that doesn't know who Greg Hunt is, he's our federal health minister. And he was given a nice little speech to read regarding FCTC and the COVID pandemic. He completely muffed that for a start. Scroll back to October 1 here in Australia, and we actually rolled out a full prescription model now for nicotine vaping products. So far, there's a lot of cracks in the system. It's not working the way they intended. There's been 3 rather large fines handed out, 2 for advertising and 1 to a regular Joe, from what we understand. The 3 fines total $66,000 so far and counting. And they're looking into stepping it up another few notches and handing out some rather large fines to other companies that they think are in breach of their new policy. But if you look on the TGA website, or the Therapeutic Goods Administration website, pardon me, it's an absolute mess. They're saying that if you overlabel something that might have had nicotine, or it was run, even though it doesn't have nicotine in it, it's then classified as a counterfeit product. We don't understand that at all, but that's one of the fines that they handed down. The other 2 were for advertising, and I still think it has to do with the .com.au web address. If it was .com, I don't think they could go after the company as such. But they're even talking now pulling down photographs of vaping items or vaping devices from websites, putting us behind an even darker cloud.
So how much do you think that Australia, I see that it's your government Department of Health is the, sending the
Yeah.
delegation over to, or that's going to be there at the virtual hearings. How much is that, I guess, how much do you think that the new regulations in place in Australia are going to be, emphasized, I guess, not so much during this meeting, because it looks like they're going to defer any really substantive conversation on e-cigarette products, but how much do you think it's going to play into how the FCTC, regulates these products, or, urges governments to regulate these products?
I I personally think, and this is no one else talking, I actually think that they're going to try and sell it as a new be all and end all to the FCTC if they get time to actually speak. They'll sell it and they'll say, "Oh, this is working so well. You should all try it." That's what I can see happening. Yet the UK is taking the opposite approach. You go and see a doctor, and the doctor will actually hand you a device in liquid to move you away from combustibles, which I think is a much better idea. But here, we can't even manufacture in Australia. We can manufacture for export, but we cannot manufacture for sale within Australia, which makes no sense to me. We import everything.
Yeah, we have stop smoking services here who can recommend e-cigarettes, and some of them have gone into partnership with vape shops who provide free kit which they can hand out, just to help smokers with a proof of concept thing. But yeah, it's completely different over there. They've turned it. They haven't even turned it into a medicinal thing. They've just they've gone this weird route with prescription without actually recommending, taking a product through the medicinal process. They're basically just saying nicotine itself is the medicine, aren't they?
Yeah,
I think.
correct. But here's the dilemma on that. We have NRT products readily available, supermarkets, stores like 7-Eleven and things like that. They also sell them in certain places. Some gas stations now sell them. But we really don't understand. Originally, nicotine was a Schedule 7 poison, which was in the same classification as heroin. Then it got moved to Schedule 4, which means it then falls under pharmaceutical. So that was a win for us, but then it backfired as such, because then it fell under their jurisdiction. And we hope that we don't see our stupidity, or what I call the petri dish of testing of Australia, get rolled out to the rest of the world. It's silly what they've done, and it's not an easy task. Out of 110,000 GPs in Australia, or registered doctors, we now have 353, 354 that have actually applied for the actual license to. But then we have the head of the TGA, Professor Skerritt, turning around and saying that actually all GPs have the capability of writing a prescription for nicotine, but that's actually incorrect. That's for the personal importation scheme. But I wouldn't want to go and see a pediatrician to go and actually get a prescription for nicotine. That's how stupid it is. I'm not going to swear, but
does anyone in Australia, in Parliament or wherever, look across the water to New Zealand and think, well, they seem to be doing things a bit better over there?
Well, the funny thing is that they did a live webinar, or it was a seminar between, and it was a live event between Professor Skerritt and two other observers from the TGA and expert advice from New Zealand. I don't think he was listening somehow. And then a follow-up a couple of weeks later, they did the same thing, but with professionals from the UK. And the UK was saying, well, if NRTs aren't working, sure, we'll advise them to go down the vaping pathway, same as New Zealand. And then Skerritt said, but we think that we should, it's not a first line type situation. It should only be used as second or third line, which we thought was very, very strange, because if you've tried giving up smoking, I smoked for 32 years and I'd have 15 failed attempts at giving it away. Vaping was the only thing that got me away from the cigarettes, full stop. But they want you to go down the pathway. And then there's also resistance from the AMA, or the Australian Medical Association, and the RACGP, or Royal Australian College of General Practitioners, that are both saying, no, it's not first line, it's third. You need to, like, medications, intervention. You might as well try hypnotherapy as well. Go and stick a few patches on you, a few pills, powders, sprays, gums, whatever else. But no, we can't use this. It's so strange.
I read somewhere that someone said that it effectively means that if you're a vapor, you have to go back to smoking first before you can get a prescription to get off of smoking with the thing that you're using currently.
Correct.
Is that right?
Yeah, correct. I've never seen anything like this. You know, I'm 52 years old and I haven't seen this much stupidity come out of a government department in my entire life. Well, okay. A lot of the stuff that Greg Hunt
Come over to
comes
the
out
States, okay? You can see, come deal with the FDA, all right?
I've dealt with the FDA and they're silly as well, but not as silly as the TGA. Unbelievable. Oh, and there's a seminar coming up, actually. I think it's on the 10th of November. I'm going to attend that as well. That one's actually sponsored by Johnson & Johnson. Hilarious.
Has Australia made any commitments to be smoke-free? Like in our last live stream, Martin, and we watched the UK delegation, you know, their video to COP9, you know, about being smoke-free by what, 2030 is what they want the UK to be smoke-free by. Has Australia made any of those commitments?
I think Greg Hunt actually touched on that in his little video.
We can play Greg Hunt's video. You're here, okay? You can give commentary. So I mean, I'm fine with that. Let me find it real quickly.
We might as well throw him under the bus as well, because, you know, that's where he belongs. But everyone said here in Australia, politicians included, oh, it's big tobacco, big tobacco, big tobacco. Rubbish. We know who's pulling the strings here in Australia right now. And Pharma has their teeth and their claws directly into the TGA, the AMA, the RACGP.
Okay, can we play Greg Hunt real quickly?
Go for
it. Okay. Greg boy. Okay, can you all see it?
Yeah.
Yeah.
Okay.
Hang on, I'm muting.
We'll start it again.
With the global impact of COVID-19, it's never been more important to protect people from the other epidemic, the health effects of tobacco. Australia is proud to contribute to the 2030 project to help low and middle income nations, including our Pacific colleagues, strengthen convention implementation. We also work closely with the McCabe Centre for Law and Cancer, supporting tobacco control in the Pacific. And we know that the tobacco industry has a long proven history of trying to delay and dilute government attempts to reduce tobacco use. Industry efforts were defeated last year with reaffirmation from the World Trade Organization that Australia's tobacco plain packaging law is a legitimate public health policy. But the tobacco industry continues to prey on vulnerable people and nations. It has pushed dubious studies claiming smoking protects against COVID-19 when in fact the opposite is likely, and positioned itself to be an economic recovery partner for hard-hit nations. Australia therefore welcomes the COP9 declaration on WHO, FCTC and recovery from the COVID-19 pandemic, particularly its focus on industry interference and the need for alternative delivery of smoking cessation and treatment services. In Australia, we remain focused on reducing tobacco use and nicotine addiction. I'll be launching a national preventive health strategy soon, aiming to reduce the adult smoking rate from around 14% to less than 5% by 2030. And we've acted on the growing use of nicotine vaping products by young people. I am proud that Australia has again led the world, becoming on 1 October the first country to ban purchase and import of nicotine vaping products by consumers without a doctor's prescription. The WHO FCTC is a key tool for protecting present and future generations from the devastating and life-destroying impact of tobacco products. We look forward to further steps this week, and for your work and your contribution, I thank you.
True.
I just say leading the world with a straight face.
He's saying to me, and I don't know, it's just when I first saw it, I just, wow, American politician is what he reminds me of. I mean, you know, he's got this like drawl about him, because they all do. They all sound Southern for some reason, but yeah. So, I mean, pretty much they're going to go up. I mean, it's kind of funny to have you both on here right now, because it looks like, you know, your representatives from your own countries, you know, are going to go to two opposite ways of, you know, approaching tobacco harm reduction products at these meetings.
He speaks there as if he's solved the problem. I mean, it's quite laughable, isn't it?
Gosh.
You know, he's saying we're determined to end the harm of tobacco use by banning the best alternative tobacco use. That we've cracked it.
100%. But this is the really interesting part, that all the figures have been saying, or the government's been pushing for the last few years, that we're at 8%. Complete and utter rubbish. We knew that it was above the 10% mark. But he's just come out and blown his figures out of the water by 6%, the original 8% that he used to spout. But then if you look at the low socioeconomic here, the smoking rate in that and the Indigenous community is up to 46% in men and 41% in women. And then we have lower socioeconomic, which is between 30 and 40%. Really? 5% by 2030. Oh, Greg, I don't believe you. I really don't believe you.
Yeah, when I first watched that video, when he said that bit, I just said, no chance. No chance. Am I right in assuming as well, he spoke in that video a lot about the tobacco industry and, you know, implying that tobacco industry is the ones responsible for e-cigarettes and other products like that. But there are no tobacco industry e-cigarettes sold in Australia, are they? Because
no, they're not. They actually turned down the application of PMI and the ICOS as well.
So in effect, when he says tobacco industry, he means independent vape manufacturers, doesn't he? Presumably.
As well, yeah. He thinks we're all tobacco.
Yeah. Daft. Daft.
Okay, well, that's one word. A lot of the other people that have seen this video now, they've all said quite the colourful spray of words, because he really is an idiot. I'm sorry, that's the only word I can use for him. How much do you think his approach is covered by the fact that he once said something about vaping products not on my watch? Do you think politically it's going to make him look really stupid if he has to step back a bit and say, you know what, I was wrong. You know, these things are advantageous and maybe we should be a bit more relaxed about them? Well, with the current political climate in Australia, we know that there's an election on the horizon. We had our Prime Minister at COP26 recently. And the really funny part, they had a stall there or a stand there representing Australia. The font that they used is the same font that Hillsong uses for a start. And then second, and the little podium where you go up to meet them was actually sponsored by Santos for carbon capture. Now, hang on. If I'm not mistaken, carbon capture doesn't even work from my understanding, or it's only very new science. So we've got a health minister spouting on this rubbish. Yet, by the way, the Liberal Party, who he belongs to, still takes tobacco money, still takes tobacco like donations in the background. Trying to say that they don't, but they do. Labor, on the other side, they stopped a few years ago taking donations from the tobacco industry. Yet we really don't understand what the hell he's up to right now. And he's just made an absolute goose of himself. And there is an election next year coming. It's been touted now for around March or April next year. And poor old Greggy boy, he's going to be on his bike because he lives in the heartland of where I used to live down in Victoria. And that's a big racing community. Like that's where all the thoroughbred racing is pretty much put together down there, down in his area on the peninsula, all the breeding and pre-training facilities. Now, that's the industry that I used to work in. All of us were smokers, every single one of us. And I converted, I don't know, probably 10 or 12 dozen from smoking across to vaping. They're all healthier than what they were because of the long hours and the stress that we're under. He doesn't understand. We're going to turn him on his head. Simple. Vote them out. That's what we're going to be doing. Bye-bye,
We
Google.
vape, we vote.
Yeah. They're going to learn a hard lesson this time round because they've woken up an industry. He was saying that there was around 400,000 vapors. We're saying roughly around 600,000 now. And by doing or pushing this prescription model, he's opened the black market up for disposables. They're everywhere now. They're not just here and there. They're absolutely everywhere. He's got no idea what he's just done. He really doesn't. Good luck.
So the journal was published. I see. Did you see that, Martin?
Yeah.
And the schedule. So we'll share that on social media. Actually, I can share it on this video on Facebook right now if I can find it.
Yeah, they're still stuck on item 1.1 at the moment.
And that's back to seeing if they're going to defer it to, I mean, didn't they already decide that they weren't going to do anything though on e-cigarettes this time around?
That was the plan, but they're just talking about the terms of what, when they defer it, how is it going to be treated for COP10? And that's where the two factions are at the moment.
Okay.
I might have heard it's a bit of a mess.
Yeah, but
Okay.
bringing novel and emerging technology, that's dangerous.
Well,
That's
and
very
yeah, and also what
dangerous.
could be out there in the next 2 years. I mean, so it's certain countries that are more liberal with how they, let these products be used by adults. You could have newer products. Other countries could be having ciga-likes by the time that they start, giving them to smokers. Or like really bad ciga-likes. I don't know. A lot of people don't know here in the States, actually, there are some prisons that actually sell e-cigarettes to prisoners. But they are ciga-likes and they don't even have, I mean, you could see the mechanics in it. It's not anything fancy or whatnot. They don't really taste that good. But then again, I guess if I was in prison, I'd be fine with whatever I could get my hands on.
Yeah, I agree with that. And I agree. It's tobacco harm reduction. You're in prison, what? You're doing 5 to 10 years and you're a heavy smoker before you went in. You get off the cigarettes and you come out and you give up the vapes as well while you're in there. You're good to go, I think. But the policies that they've got playing out here in Australia, they're absolutely stupid. I hope the UK does the right thing now and pushes the opposite end of the spectrum. And I do want to see that part completely removed, like new, novel, and emerging technologies, and handing it to China. That doesn't make sense because most of the vape manufacturers are out of China.
Interesting news coming in from there is, I think we mentioned before that they don't generally vote at COP9 where they're voting at the moment, which is highly unusual. They're voting on the wording of this proposal, so that's why it's been going on so long. They've got two factions, and they're actually going to vote. They're voting line by line on the wording. So
wow.
I will note though, on their videos, they don't really have that many viewers on those YouTube videos. Poor Brazil, he's been on for an hour and he's only had 8 views, you know. And Greg's only had 140 views.
Yeah, but we've been pushing traffic his way, and there's a reason behind it. There might be a few parody videos come out of this. I don't know.
Yeah, I'll be downloading some videos, so we'll have some fun with it. So
that would be very mischievous, wouldn't it?
Yeah.
Oh, never. I don't get up to things like that. I'm a good boy.
Well, Paul, thanks for joining us. I might have you join us again on Friday. We can recap what happened and everything, because I'm pretty open right now as far as getting people to come on. And you know, it's easy, relatively pain-free. You know, viewers, thanks for watching this. I guess this was hour 10 of Monday on our COP9 week live stream with Martin and I at the Consumer Center at the Taxpayers Protection Alliance. You check out all these videos on Facebook. We will be uploading them to YouTube, and we'll have a recap video, and just keep monitoring our social media, and we'll be giving you updates as these behind closed doors meetings, you know, continue on, and what happens on the World Treaty on Tobacco Control. Or Martin, any last words from you?
No. Well, yeah, if we're doing a catch up later, hopefully things will be clearer by then. But these things do drag on. I remember COP7 in India. There were talks that went on throughout the night on one night, so they can drag on if they get a sticking point. They have to talk about. Things might not be clear till tomorrow at this rate. Who knows?
Absolutely, the bureaucracy. So, well, thank you again, and enjoy everyone. I hope they enjoy their Monday.